Hey everyone, this is Dr. Charlie Johnson, physical therapist. Hope you are doing well. Appreciate you checking out my channel in this video. And in this video, I have a member of my private coaching program, what I call the Glute Relief Accelerator Program. Her name is Jennifer. By the way, do you prefer Jennifer or Jen?
Either one.
Cool. Jennifer, she's in sunny Southern California. All right. I'm so grateful that she's here to share her story. I know it's going to inspire a lot of people watching. You were dealing with back, butt, kind of leg, hamstringy, kind of maybe sciatica-y stuff, right? For quite some time. And so if you wouldn't mind, just sharing your story a little bit, kicking it off, sort of what you were told was the reason for why you hurt, Jen, and maybe some diagnoses that you were given, just to give a flavor of kind of what that looked like for people who are watching. Again, Jen was a member of my private coaching program and just totally crushed it. I'm super proud of her. She's come a long way. So.
Yeah, I'm glad to be here. Yeah, at this point in time too, because I feel great. So I actually initially had a true fall. And so had seen my primary care physician who really kind of said, yeah, after the physical examination, it's probably not a disc, even though I was having sciatica, it's probably Piriformis Syndrome. These things kind of go away on their own, kind of hang out for 8 weeks. 8 weeks passed and, I was referred to physical therapy. So I kind of did an online program for probably another 8 weeks. And then that really wasn't working for me. Still working on more about, lower back injury causing the sciatica and all the other kind of pain that was moving all over the place in my hips. And so the physical therapy really focused on, I had, the assumption that I had some bulging discs.
Yep.
And so, after probably 9 weeks of that, they decided that they should do an MRI. So an MRI came back with really not a lot going on, except for, kind of what you would expect to see in somebody my age. So, almost 60. Yep. So, really said, at this point, maybe you should try a chiropractor. And so I went to the chiropractor, for a couple of weeks, and the chiropractor was like, hey, this is Piriformis Syndrome. Yep. So kind of going back and forth between this bulging disc, Piriformis Syndrome. And I was like, hey, really not doing too much with the adjustments. Let's do some really serious massage therapy to get in there and improve the piriformis. And if not, we'll do some steroid injections.
Okay.
So at that point, I'm Googling. And so I ran into some of your videos on YouTube and said, hey, I'm definitely going to give this a try. I was in so much pain from the massage and just, really kind of in a desperate scenario. And so got hooked up with you guys at that point. So.
Awesome. Okay. So basically, just to kind of recap, you fell, right? And then obviously it hurt, right? And you went to the primary care doctor and said, hey, it'll probably go away. It didn't really go away. You tried some sort of online virtual process or program online, didn't really work. Went to PT, it sounds like maybe for a couple months too. That didn't really work. They were treating a disc problem. Then it's like, hey, that doesn't work. Let's go down the line. Chiropractor, sounds like they did some deep tissue stuff. We're treating it as a pain in the butt, right? Which it was, Piriformis syndrome, but there was kind of this, torn diagnosis, right? Between a disc problem or a piriformis problem. And that's, different treatments due to that. All right. And then found us online and decided, hey, I'm in a lot of pain, especially after the deep tissue massage. By the way, if you're watching this, you've had deep tissue massage to your butt. It's very common. That actually aggravates the problem, especially if you're dealing with a sensitive nervous system, right? So got linked up with us, and then the rest is history. So let me ask you this, right? So what was the impact that this was having sort of on your life at that point? So when you say like, hey, I was in a lot of pain, like what did that look like? What things were you struggling with, et cetera?
It was one of those scenarios where things didn't start out too bad, but over time, with so many people telling you different things and, not to do this and not to bend and not to move, that my whole world became like this, like compressed. And all the movement. So I'm somebody who was active and working out actively, and then became where you're like, you're doing nothing, and then you're scared to do anything. And then you're constantly aware of every single thing that you're doing, and you're hypersensitive to the pain. And so my world got really, really small in terms of, how much room I had to move in. And, things were, where I wasn't supposed to bend, that I wasn't supposed to lean over, but I could squat to pick up things. And then, my knees kind of blew up. And so that even made things worse. And so I was in a pretty bad place as far as really not doing any movement, really just feeling paralyzed and in pain, really.
Wow. Yeah. And your story is very common. I see this all the time, right? So like an injury starts, right? And then you start trying to figure out what it is, right? I must have hurt something, or I did hurt something, right? Regardless of whether you did or you didn't, you had an actual injury, a fall, right? And then it's like, okay, I've got to figure out what this is, right? Rightfully so. It's sort of the way we've been trained to do it. So we go to different people. We rely on them to try to tell us things. You were told multiple different things. You live a life where you're like, you can do all this stuff. The box is this big. And then it starts to just shrink and get smaller and smaller because things hurt. The more things hurt, the more anxious, worried, fearful you become of movement, right? Movement is bad, and you just reinforce this negative feedback loop, we would call it, right? And before you know it, you're not doing a whole lot. Fair to say?
Oh, that's fair. That's fair to say. My nervous system is getting revved up just talking about it and how bad it really was.
Yeah, it's a frustrating spot to be, for sure.
Yeah.
Now, look, I want to talk about this because I think this is really important. I want this to be valuable for people watching. So obviously you've had a great experience, right? You can share more about it if you want, but I think there's value here in the sense of you mentioned, and if it's cool, can I read one or two, like just a couple lines off of your case review that you submitted before you started working with us?
Sure.
Okay. So we have everybody who, reaches out and is interested in potentially working with us, submit what we call a case review. I don't believe in charging people before I feel confident I can help them. Hopefully that's fair. So we offer to review cases for free. We jump on calls with people and I review all cases personally. And this is what you wrote. So we asked this question to you. We said, how is this program impacting your life? You said, my activity has been very limited. I need movement and physical exercise to balance my life. During PT, I was told not to bend over, which you just said, which never really seemed to bother me to begin with. This resulted in squatting for many daily activities and made me extremely conscious of the issue, which I believe may have caused more pain, not only because of the repetitive squatting motion, but because of all the attention on a potential disc issue that was not getting better, right? So this is really fascinating because this goes into the psychology of pain and belief system. So you started out, right? And many people watching this will have some label that they think is the reason why they hurt. It could be a disc, it could be piriformis, it could be arthritis, it could be hips out of alignment. Just there's millions of them, okay? I hear them every day. And because of that, right, you were so focused on, and it wasn't your fault, the PT even, right, the professional was so focused on, hey, we're going to treat this diagnosis versus you said something interesting. It didn't really hurt me to begin with, but I was avoiding this thing because I was told that I shouldn't. So can you speak to someone who might be watching this, right? Maybe you talk about your own experience, but who's kind of feeling trapped by like, I'm listening to what they're saying. I've been told that this is wrong with me. And then we're treating this diagnosis, but it's not working. Like, how did you get out of that? And what was that like for you?
Well, if it doesn't add up, like a bell should go off and go, hey, that doesn't add up. So, you want to trust the person that's caring for you, like a physical therapist or your primary care physician. But what it comes down and what you learn in this program is that you know your body best. Yeah. If it doesn't make sense, then it probably doesn't make sense for you. And so, when I was not doing what the physical therapist told me not to do, I was programming my body and programming my thoughts that I can't do that. It causes pain. And it was compounding. So I'm not sure if I answered your question, but that's one thing you do know is that you do know your body. And if it's not making sense, then you should pay attention to what you're doing.
Yeah, because there's, every single day I hear people reach out to me and say, hey, well, like, I've been trying to sit up tall all day, right? Because that's what I should do, right? I should have this perfect posture. Or I was told that I should sleep this way or move this way because it's good or it's bad, or there's some kind of, there's some label that people place upon it. And it really gets into your belief system because it's not your fault. You don't know, this isn't what you do for a living, right? And so then what happens, you start to listen to them, right? Because they're sort of the expert and they're the doctor.
Yeah.
But then when you listen to them, you actually reinforce, if you're not careful, number one, that what you're avoiding is dangerous. So you actually start to train your brain to experience pain and link those two activities as problematic and danger.
Yes.
Right? Yeah. And then at the same time, right? You are like not tuning into your body. You're like, hey, this is what I feel. It feels safe to be able to bend forward, and it never really was a problem to begin with, right? But they told me not to, so I guess they're right. Who do I listen to? Do I listen to them, or do I learn to listen to myself? So that's why I wanted to highlight that. As I was reviewing your case, I thought, man, that's fascinating. It's very interesting.
Yeah, it's so true. It's so true. I remember like I'm an avid gardener and just not being able to bend over all summer or garden. And every time I wanted to, I'd be like, oh, I can't, And so then afterwards I couldn't. So yeah, I
Yep.
mean, over time, it was pretty bad. So
Yeah. Yeah. And so again, if somebody is hyper focused on the diagnosis, right? But things aren't really adding up, and that which they're doing to try to treat the diagnosis isn't working. At some point, if you're watching this, you've got to say, I've got to do something different. And maybe, just maybe, I control my mind and my body, and knowingly or unknowingly, this thing started because of it, right? And who knows it better than myself? And so, how could you learn, right, to resolve this naturally, versus just relying on what somebody else thinks or believes or tells you to do, right? So I'm a big advocate of obviously teaching people like you, Jen, how to resolve their own pain. So that being said, right, let's talk a little bit about this. So, okay, Charlie, if you don't treat the diagnosis, I have this disc issue, right? I get these scripts, disc problem, treat, right? Stenosis, piriformis, treat. And many people chase the diagnosis. You went to the chiro, they did this because of that. The PT didn't have you bending because they were treating the disc, but you're kind of this person and you exist outside of this image or this thought process. So how did it vary? How did the treatment approach vary compared to, you saw other PTs, I'm a PT, right? And so what was different, you would say there?
compared to your program versus the other experiences that I had,
Correct.
I mean, there were a lot of things different. Okay. So it was really, you learn your body by, trying things out. But I think, the whole idea was, calm, first of all, stop everything and calm your nervous system. And let me provide you with some information to
Yep.
help you understand potentially what's going on with yourself.
Yep.
So I got lots of information as I'm reading it, as I'm hearing it on the videos. It's registering with me in different areas of my experience. And so I was able to learn things and to be assured that there was nothing wrong with me. That was like huge, that, maybe there's nothing physically wrong with me. And that, I guess that's a big part of it, is that, going to all the doctors, there was something wrong every time there was something wrong. And so being assured that, physically, maybe there's nothing wrong with me, and let's go through this evidence list. So maybe, you'll know if there is or not. So very big starting point, kind of like, that set the trajectory for, yeah, there's probably nothing wrong with me, now where do we go from here?
Yeah.
And so, that was kind of a big deal. And then where do we go from here as far as getting back into movement and exercise, and, how do you get back to being pain-free?
Yeah.
So, I guess that was probably the biggest difference, is that there really wasn't anything wrong with me. And here, let's figure out how we can move down the road and get back to my normal life.
Cool. Yeah. So basically, just to be clear, right? Because some people might take that idea of like, hey, there's nothing wrong with me, and be like, the dude's crazy. What does he mean? I know there's something wrong with me. I hear you. I'm picking up what you're putting down. But what we're saying is, yeah, so structurally, she fell. Okay. But now we're dealing with, by the time you got to me, I think, gosh, over half a year of stuff.
Right.
Right. And so what starts as sometimes a very physical structural problem, think about it. A paper cut heals within a few days, right? A broken bone, even if it's really
Yes.
bad and you've got all the negative things that would affect bone healing, maybe a few months, 8 to 12 weeks, right? But then why is it that pain persists beyond, say, 3 months, 6 months, especially? Well, it could be that because of what you've been told about how you should move, you shouldn't move, because of all the stuff you've been told about what's wrong with you and how you feel more broken every time you go to see someone, you start to become fearful, and you start to, again, train your brain to experience the pain that you're experiencing. It's very real. It doesn't mean it's made up, but that's what we're referring to. And this is an often overlooked area for people who are stuck in pain, because everything goes back to the diagnostics and kind of what's wrong with you.
Right.
And everyone treats that. And so was it just helter skelter? Like, did I say, hey, do these 10 different exercises and we'll just hope that they work? Like, what did that look like?
No, it was a pretty targeted program. So, identifying, potentially, what my pain pattern was, and, or is there anything I could physically be doing that would help me? Is there an exercise that would help me? And so, kind of going through, targeted programs where you're tracking your pain levels each week. I mean, that really helped me out. I mean, and then how, kind of how to move through that too, because you're constantly hunting for motions that could potentially help you. And then you're measuring and monitoring your performance. Did it help? Are you the same? And so it was very helpful. The videos were very helpful in terms of what do you do next. So that whole process was very measured and very articulate and gave you confidence in the data. I guess I'll call it the data part of the program in terms of measuring and being able to move forward with progression. And so that was really helpful also.
Yeah. The idea here is you can't manage what you don't measure. Right. And so I think that goes for a lot of areas of life. If you're going to lose weight, you probably have a scale. If you're going to try to improve your blood pressure, you probably measure it every once in a while. Right. But lots of people, when they're in pain, it's like, hey, do these exercises. It's like, well, how do you feel? I mean, it's hard to track things when you're really subjective and fluffy about them. Right. And so basically what you're referring to is systematically tracking the sort of indicators that are most important to determine, are you on the right track? Are you stuck? Are you heading the wrong direction? Do we need to change anything? And what do we need to do? And we make those decisions based off of logic versus just the emotion. And so many people out there in pain, when you're in pain, you tend to go insane. That's okay. It's normal. But that's just the human in us. But at the end of the day, if you're kind of helter-skelter running around trying lots of different things, you don't have a way, or whoever you're working with doesn't have a way to measure them, I don't know how you're going to find the solution, at least very clearly or very quickly.
Yeah. So it does keep you calm. It keeps you grounded. It keeps you moving forward with your eye kind of on the target, because like you said, you can go crazy when you're in pain. You're trying to kind of move through this process, and you're trying to get better. And so, that was kind of like a grounding process for me, as far as, okay, there's probably nothing really wrong with me and I'm probably healed, but let's look for an exercise that makes me feel better. So it was this element of the program that was like, okay, there's something I can do that does make me feel better. And it was just another way of anchoring myself to getting better.
Yeah. Totally cool. Yeah. I say using movement as medicine, right? Like you generally don't want to take 10 different medicines at one time. Yet people do it every day when it comes to, like, I go to PT, and PT, people think like sheet of exercises. I would say it's the inverse approach to what I would recommend. I think you would agree with that. So we want to be scientific in how we go about doing it. Very cool. Now, like, where are things with the back, the butt, the leg, like, at this time? Are you pleased with where you're at? What's happening? Right. I know you tried other programs.
Oh, yeah. Yeah, so I'm doing great. And I say doing great, I mean, I just, I'm measuring myself every week on the program that you're talking to me about, the weekly tracker. Doing really good. I mean, the hardest part was like, once you have everything under your belt, and first of all, starting the program, you kind of stop everything. And so you're able to, like, I'm done with the chiropractor, I'm done with the physical therapist, I'm done with massage, and everything kind of got better pretty quickly.
Yeah.
And so it's just really a big boost to feel a little bit better. But then you start like, okay, let's get back with the exercise. Let's get into exercise on a kind of a gradual basis. And I think one of the biggest things that helped me get there was, do I feel safe doing it? Does my brain think I can do it? And so, and then also, when can I exercise? So when you look at the different levels of pain, there's green where you're really not in pain. There's yellow where you're kind of in that cautionary phase, and there's red where you're like, oh, let's calm it down because we need to calm the nervous system down. But knowing that when you're in the yellow section, yeah, go ahead, give it a go. If your brain says you can do it, do it. That was like your freedom to, like, the flag, like, go, you can do it. You know what I mean?
Yeah.
And so kind of getting back to the exercise was kind of the hardest part. And so I would say probably the last 2 months, I've been doing that. And so, the first few times, to expect to be in pain, to know that you're going to have a flare up, to know that this is part of the process, going through that pain cycle and not getting your nervous system flared up. I mean, and staying calm and trusting the process. And those are 3 words that have been invaluable to me. Trust the process, because I've gained all this information from you, all the resources that the program gave me, and I got them in my back pocket. And I'm moving forward on this graduated program of exercising. And when my nervous system starts to flare up, I got those things dialed in. They're in my back pocket. I know where I'm going to calm myself down. And then I'm going back at it because I'm in the yellow. And then I start being more in the green. And then I start exercising more and I'm in the green. And so I would say probably the last 3 weeks, that's where I've been. Awesome. And, like I had sent you the message, like, it's a new year for me. Like, when I think of my daily activities, it's going to include exercise. I mean, man,
very
I
good
couldn't be happier. So anyway, yeah.
Cool, cool. Awesome. Yeah. No, look, I'm really proud of you. And I think a process is key for people. You know, again, there's this sort of random process. I actually had somebody reach out to me the other day and they said, well, hey, I don't want to be told to trust the process and then pay me. Right now, in all fairness, right? This person is totally anonymous, but at the end of the day, I think a lot of people might think that, you know, like, okay, here's this person on the internet and they're telling me, oh, just trust it like everybody else. But, you know, the alternative to not trusting a process is just random, like having no process. And so if you could follow a scientific process, right, and you could learn to fix yourself, I honestly don't know of a better way to help people resolve their pain than giving them what I know in a very systematic, process-driven fashion. So trusting the process is very important because there will be ups and downs. And people see the downs as like, oh my gosh, like I had a flare up. It's like, hey, you do realize in order to know how to ride the bike, you have to fall off it. And so when you can start to get to that point in the process and in the program where you see that as an opportunity for growth versus, oh my gosh, this doesn't work, you know you're onto something, right? And so when that attitude shift changes, that's really important. Also, the goal is to give you like these decision-making frameworks so you know, when should I exercise? When should I stop? When is that too much? When is that not enough? Should I just rest? Should I not? Is that making me worse? It can make you worse. And so I appreciate you touching on that because that is a big key to you having the ability and the power to say, I know what I need to do, when I need to do it, how I need to do it.
Yeah.
Really cool.
Yeah, and having access to the community and you and you know the people you have on staff and you know somebody who's suffered through pain and can't calm themselves down and just to be able to reach out 24/7 if they have to get that support to calm themselves down so they can start moving forward again is really invaluable. I mean, you know, that's my experience. And those
Awesome.
things have really helped me get here. So
Cool, cool. Yeah, look, it's been a pleasure working with you. You're doing awesome and you're going to continue to do awesome. What would you say is like a last little closing remark, right? To someone who's maybe tried many things, just like you had, right? And is like, hey, this is probably just another thing, kind of what makes this different, right? Like they think maybe it's going to fail or it's not going to work. What would you say to someone who's sort of on the fence there thinking that this is just another program?
well, I think that first of all, you know, when you're deciding whether to join the program, you don't take people in your program you don't think you can help.
Yep. Yeah.
So it's not like, oh yeah, just you know, write me a check, you're in, let's go. You know what I mean? It's like, you know, can we help you? And so I think, you know, that gives you some confidence. I feel like you're in an excellent place with the best chances of getting better. And you know, everybody wants to be pain free. And I think this is a really good chance at being pain free. And the tools that you're going to learn are going to be lifelong tools. And just so you know, I did have a neck injury 3 years ago. And it took me 2 years to get better. And I will tell you, since I've been on this program, I haven't had any neck pain. I've applied the same tools that I've learned in this program to my neck injury. So I really believe that it's not just this hurdle. We all get hurt. We all have pain. And sometimes it's cumulative, but I think these tools are going to help you be more pain-free, if not completely pain-free. And they're going to help you the rest of your life.
That's the goal. Make you self-sustainable, give you tools and concepts and principles, not just tactics. Do this stretch, see what happens, right? That you can apply not only to this area, back, butt, sciatica problems. That's my specialty, but also other areas. So, Jennifer, thank you so much. I appreciate it. If anybody's watching and you're feeling stuck, right? You're feeling like, hey, I tried this, I've tried that. And you can actually teach me, Charlie, how to fix myself, just like you did for Jennifer. The answer is probably yes. Now, in all fairness, I don't know what you're dealing with, right? So just like Jennifer said, we do pride ourselves in making sure that the people we work with are a really good fit for the process, right? So I don't want to just help anybody. I want to make sure the person who reaches out to me is a good fit for the process, right? We'll just be upfront, and if we don't feel you are, we'll tell you. But first step, if you're interested in getting help, there's probably a link somewhere below this video or somewhere around this video. You can click. It's going to be apply here, if you will, submit details. After you set up a time to chat of your specific case, a formal case review, just like Jennifer did. I review the case personally. If I don't feel I can help, we cancel the call. No harm, no foul. You go your own separate way, and I give you some recommendations. I'll reach out to you personally. If we do feel we can help, you know, we can chat about what that looks like. So if you're needing help, if you want a different approach, if you think it's cool to be able to fix yourself and you don't want to rely on other people and you want to do it naturally, you can click the link below to apply to work with us, and we'd be happy to see if we can help.